Thanks for joining me to talk about getting results, taking it to the next level, and meeting your potential with Minimedap. I'll show you the reason to use our MedNotes app for productivity, performance, potential. Minimedap is a greener, safer, and multifunctional lightweight mobile EHR. Success in care depends on your productivity, performance, and potential. We can ID these three qualifiers from students to senior medical staffers. If any one of these three is missing, there's usually a reason. I noticed to be true while working at the hospital as a resident intern before transferring into medical devices and software development. We understood the daily logistical and organizational problems with working with patients and medical staff. Personally, I knew there had to be a better way of working at the hospital with a patient caseload and on-call duties. The expectations for preparation and readiness is the delivery of that care. I knew that the early adoption of EHR systems was beyond the scope for many of us, and it really hindered our performance and productivity as junior medical trainees. I thought there has to be a better way to get prepared for the real thing without risking failure to perform. So after I had some time to think about it, I began to work on a mobile EHR version that will improve on the logistical and organizational steps in a healthcare environment for any healthcare worker that documents and cares for patients. These three tenets to follow: productivity, performance, and potential. Productivity has to do with the accessing of information and resources. Performance has to do with time and resource allocation. Potential is a measure of the utility of minimum time and resource at the lowest cost-benefit ratio, essentially being on fire for what you love to do best, which is take care of patients. Medical reference. We can identify that using our AI referencing features allows us to identify reliable, trustworthy, and free medical references within the scope of the app. For our students, this is a highly sorted feature in a health app because of the ease to look up a clinical query on an internet search. Patient education is also key to a healthy relationship with their primary health provider or medical staff or physician. Patients find it very resourceful to understand their own medical condition when they are given quality and trusted websites for information. Secondly, patient docs and profile references. I understood the frustrations that came with administrative duties as a medical staffer. I worked as a medical resident, and I created this application to solve many of the problems healthcare workers face with patient data and documentation. For example, I had a senior resident who wrote each of their patient summary information on a deck of index cards. Each time a new data changed, the index card of the patient would be updated or completely rewritten on a new index card. Intern residents like myself would take a copy of the patient's list for the weekday and make notes on the margins of the pages. This written notes on the patient's pages became nearly illegible almost every time during our late roundings with senior staff and residents. For most medical workers, they nearly couldn't afford the time or energy to write a new note entry into the patient's chart and would rather copy and paste the previously written patient chart note. These are classic problems that can be solved with a mobile EHR app. So when a medical worker is managing a checklist of issues with a patient or with a medical staff, it may not require an immediate update to the patient EMR or formal documentation. However, any patient or medical issues may still require tracking and notation as applicable in patient progress, treatment changes, and any documentation steps like patient history, differentials, or lab results in order to address the issue and make a formal documentation as part of an established standard of care. Basically, a mobile EHR app on your smartphone is a greener, more attractive, better, more efficient workflow, improved patient care, and safer choice. Social distancing with mobile healthcare IT applications and cost. With COVID-19 pandemic, higher demand on medical trainees and medical workers is enormous. Social distancing barriers have left trainees and medical workers feeling less equipped for the healthcare business. Ideally, in the world today, the COVID pandemic has affected how we visit the doctor's office. Doctor's offices are now highly restricted to protect patients, and so we have to find alternatives for healthcare delivery, as in telemedicine or home visits. Mobile EHRs are growing in acceptance as a safe alternative to protect healthcare workers and help prevent exposure and spread of COVID infection. Most mobile all-in-one IT applications require contracts and high maintenance fees. Our EHR IT solution is designed with documentation features to aid in streamlining the EHR charting workflows by the medical staff without integrating or intending to replace existing billing, scheduling, or coding practices that can render the IT mobile solution more expensive and bloated with unnecessary features. Our IT solution is inexpensive and will help the medical workers stay organized and productive with handling their patient care and administrative duties. Thank you for listening to this Minimedap presentation. To join in the discussion or follow up for any updates on the final release, or you'd like to start using our app, visit our website link to the Google Play Store. Please send us your comments and messages on Twitter. And if you'd like to follow me on LinkedIn, here's the LinkedIn URL handle. Thank you.
Thank you.